Hi everyone, I wanted to show you our medical supplies that we have here at the clinic. So on the first shelf here, we've got lots of different bandages. So just Band-Aids there. And we have some more Band-Aids. And these are really nice too. This Tegaderm is really nice because it creates sort of a waterproof seal over a wound so that it doesn't get wet. And it's just like a nice thin layer of plastic you basically put over someone's wound. It's really nice. And it's also see-through. You can see through it to the wound. And it comes in different sizes. We have small, medium, large. And we also have here, we have some gel dressings that aid in healing. We've got more Tegaderm. There's Adaptic. This is really nice. I like using this because sometimes someone has a weeping wound, and this is just really nice. It's got antibacterial ointment on it, and you put it on the wound, and then you can put 4x4 gauze over the wound in a dressing, and it prevents the gauze or the dressing from sticking to the wound, which is sort of a common problem when you put a dressing on a weeping wound. So this Adaptic works really good to prevent that, because when dressings stick to wounds, it's really painful, and you have to be very careful removing it so that you don't tear the patient's skin open again. So this is really helpful. I like this stuff a lot. And what else do we have? There's a collagen wound dressing, which also facilitates wound healing for patients. And we have here iodine to cleanse the skin. There's Hibiclens to cleanse the skin. We've got lidocaine to, this would be used to numb part of the patient's body right before we do a minor surgical procedure on them. And we have lidocaine in these bags that has epinephrine. No, that's just regular lidocaine. Let's see. We do have different strengths. We've got 1%, 2%. So the 1% is weaker than the 2%. So if it has lidocaine with epi, this label is basically red. And lidocaine does need to be protected from the light. So I'm going to put this back in its bag. I just pulled it out so I could show you. And we have here, these are kind of nice. These are Telfa. So these are pads that they kind of act like gauze, but they don't stick to wounds. So you can use these too. You can put this over a wound and then put a dressing over it to to provide a dressing to a patient. So you have that option as well. And we have lots of different suturing materials. So you can see in here, we have the different sizes. So remember, the 6.0 is the smallest. And then when we get to the 3.0, that would be the largest that we have. We also have Steri-Strips, right, instead of sutures, to put back together someone's cut that they have on their body somewhere, or laceration. We also have Dermabond that we can use to close up a laceration. These are really nice. So this is the liquid glue that would go with the Steri-Strips for that procedure, to put Steri-Strips on a patient. And we have here's the ethyl chloride. So this you can use to numb a patient's skin temporarily before you do an injection on them or some kind of procedure on them, so you don't hurt them as much. And we have these little containers. When we do biopsies, we put the tissue in here, put the patient's name down, their date of birth, our initials, the date. And we have here finger cots. These are used to control bleeding when a patient has a cut finger. And we also have, this is kind of nice, so we have oral lidocaine if the patient has a wound inside their mouth. Here's some more Hibiclens to cleanse the skin. And we have here kind of the same stuff. So that's the first row. On the second row, you will see we've got surgical gloves for the providers. These are sterile surgical gloves. And we have the different drapes. This one's regular. Actually, this one's fenestrated. So fenestrated versus regular. We have different needle sizes for the procedure. And we have here, there's some bacitracin ointment. We've got different needles. So 18 gauge versus 27 gauge versus 22. Here's the syringes, the different syringe sizes we have. And here's some big syringes, 10 ml syringes. And then down here on this other shelf, we've got finger dressings that we can put on patients. We've got blades. Here's the bandage scissors to remove a dressing from a patient. Here we have disposable scalpels, 2 different sizes. We've got the 11 and the 15. So the 11 is sharp and the 15 is blunt. And lots of different tape. We've got a magnifying glass to see something up and close. Here's all the dressings we have, different sizes, and the gauze. Here is more scissors to cut off dressings. We have some hydrogen peroxide, there's alcohol. The Silvadene cream is really nice. This is used for burns. So you put this on about 1/4 of an inch thick to treat burns. You just keep applying it to help them heal so they don't scar as much. And then there's some chucks down there as well. So I just wanted to show you some of the supplies we have in our cabinet. So let me know if you have any questions. Thanks.